Hi, Michelle. It's Linda Sullivan at Hamilton Arms. I just have one question for you.
Sure, sure.
I know that you are doing all of the attendance, and you did say you were sending them out to the administrators or submitting them for us.
No, we will be sending them out to you.
All right.
In fact, I was just Karen Vleck is having some computer issues at home. All of our administrative staff are working from home here for over a year now. And I'm just texting her to see if she's back up for this session, but I will be talking with her later today about getting that started now that we're finishing up. And all of our sessions have been recorded. So if there are any makeups that need to be done, that can be done. But I need to get all of that coordinated. So not to worry. Okay.
Thank you very much. I appreciate it.
I'll be announcing that as everybody gets on right now. Our last session, my goodness.
I know, but thank you.
Oh, my pleasure. Okay. And good morning, Pennsylvania. So we folks are logging on, getting facility names in our chat box and individual names as well. And I was just texting here with Karen Vleck. She'd had some electronic challenges from home this morning, but she said she's up and running and we'll be on our session shortly. So that's good. It is a very dreary day here in Maryland. I don't know about Pennsylvania or Victor, are you in New Mexico?
No, I'm in DC, in Maryland.
Oh, okay. All right. You know, after 16 weeks, I should have known that. All righty.
Good morning, everyone.
So it is our spring flowers will grow based on these March showers. Okay. Good. Looks like we got a good group coming on here. And one more reminder to place in the chat box your facility name and the names of each of the individuals participating. And then I will say now, since I think most folks are up and running, that Karen Vleck and I will be speaking later today, now that we're finishing up, this is being the last session. We have received from Project ECHO attendance records based on the registrations that we have submitted, and we will be distributing those to the individual facilities. We also will provide a link for any sessions that need to be made up in order to complete the requirement. The requirement for each facility is 2 staff members attending at least 13 of our total 16 sessions. And again, all of them have been recorded, so they'll be available and more to come on that. But Karen Vleck and I will be working through that administrative piece later today. Okay, so not to worry. Good, Karen is on right now. So in fact, Karen, I'll be calling right as we finish this session so we can begin to plan for that administrative next step here. Okay. All right, so one last facility name, individuals in the chat box. So Karen's got everybody's registration and she will be busy getting, we're up to date. So all of our prior 15 sessions have been, the registrations have been submitted and we'll get this in as well. Okay. All right, I'm going to start by sharing my screen today. And let me just get to our PowerPoint. And all right, session 16, our final session together, and it will be Victor and myself today as the speakers. Our learning objectives will be to be able to describe key leadership behaviors that support quality improvement, and to identify ways to use quality improvement processes to improve the communications during this COVID-19 pandemic and going forward. We certainly have much more we'll be communicating to our staff, to our residents, to their families. Leadership is a big part in leadership strategies and using quality improvement processes to improve our communications. So our agenda today, I'm going to be using the IHI videos for this session. I found them very informative. And so we'll take snippets of our IHI videos. Two of them will actually show about 5 minutes of each. The third from Paige Hector, our expert in, she's a social worker, consultant, does a lot of staff education. I'm going to show some of her key slides and takeaways. And then we're going to actually use the case provided by our national program to talk about leadership. So we're going to start with this video. David Farrell is a licensed nursing home administrator and social worker, and he's going to talk about leadership as a administrator during COVID. Whoops, let me go back here and come back here. And now we're ready.
If I work in the red zone, and the best thing that leaders
Hold on a second.
can do for their. Hello, my name is David Farrell, and I'm a nursing home administrator in Berkeley, California. Thanks so much for joining my ECHO session on leadership and communication during COVID-19. I want to share my perspective as a nursing home administrator. Throughout this pandemic, I have been a bit of an emotional roller coaster, if you will. This all started with nursing homes being third on the list of the CDC priority list for testing. And ever since then, it's felt like every nursing home outbreak is just like a cruise ship with no place to dock. And the dominant fear that I've had is related to the fear of making a mistake and hurting someone, or the fear of bringing the virus home to my family. And I know that nursing home leaders around the country live with this fear every day, fear of the next outbreak and fear of residents and staff losing their lives. I've also had this immense frustration because many mandates have come out that have been difficult to follow. The immediate stop of visitation, the immediate stoppage of communal and dining activities. It's not that easy for a nursing home to pivot so quickly because it really is just like a cruise ship, and it's difficult to steer and turn that cruise ship on a dime, which the mandates require. And of course, we've all had the frustrations with testing. We learned early on that surveillance through monitoring of symptoms was absolutely fruitless, and we needed testing. We needed preventative, aggressive testing, widespread testing, over and over again. And now finally at this time, that's coming to fruition, but it took a while to get there. We need timely testing, we need timely results. And for the most part, that didn't happen for many nursing homes during this pandemic. And of course, we've all become jaded due to the ever-changing guidance. And the more specific the guidance is, the more skeptical we are as nursing homes and DONs, because the science changes and the guidance changes. Yet we all know that we'll be judged in hindsight. We'll be judged not by what we knew and did in April and March and May, but will be judged by what everyone knows we should have done in the month of December. So the ever-changing guidance, of course, puts administrators and DONs on a path towards what 2020 vision really is, which is, in this pandemic, we'll know so much more in December than we know here in September. And that's how it's gone throughout the crisis. I've always been a nursing home administrator my entire professional life, and it's always been an emotionally demanding job, but never more so than now. I've always felt overwhelmed on a normal day, let alone during a pandemic, but this crisis is is a real leadership opportunity for us all. We're never going to forget it. And people will never forget the leaders that were around them when outbreaks did occur. Early in the pandemic, colleagues said to me, you know, how do you want to be remembered after this? And of course, we thought after this would be over by now. But he asked, how do you want to be remembered after this? And I paused and said, I want to be the leader the staff needs me to be, you know, in that moment during that shift. The New York administrators who lived through the initial outbreaks produced a document to help guide future, administrators with their outbreaks. And they offered this advice. They said, we should validate and support and encourage our staff, validate their fears, support not just them, but their families, and encourage them to come to work and to trust that it's going to be a safe place to work and that you have plenty of PPE. The New York administrators advised us to act calm because the staff needs to see that you're acting calm, and that you should share everything that you know with the staff, citing sources and data, showing them research, displaying the CDC websites, whatever it takes so that staff can truly trust that you're very well read about what's happening in your county and in your state, and that you're able to cite sources for the information that you're sharing with them. What the staff wants most is a sense of predictability, that everything will be okay during this shift, or everything will be okay tomorrow, or everything will be okay if I work in the red zone. And the best thing that leaders can do for their staff is offer them a sense of predictability around safety. So what matters most during COVID-19? What matters most during this pandemic? Well, you matter most. DONs matter most. Administrators matter most. Medical directors matter most. And so keep in mind that the effort that you make to show how much you care about the staff, how willing you are to listen to their concerns, and how dedicated you are to manage their job stress, this is how you'll be remembered by your staff during this crisis. It's your caring approach.
Sorry. Let me get this down here. Give me 1 second. Righty. And let me go back to the PowerPoint presentation. And let's talk about this case provided by our national experts for this session. And let's discuss it. So we're going to start with a case of Patty, who is a relatively new director of nursing, only been in the position for about a year. Prior to that, she was a nursing supervisor in this long-term care space, deeply committed to the care of her residents and the quality of life of her residents and staff, and devoted to improving the workplace culture and finding joy in the work for her nursing home team. She has a number of strong mentors and colleagues at other nursing homes and professional associations. So our first point for discussion is, let me go here. What do you believe are the top 2 most important qualities for a nurse leader in long-term care? So as Patty's beginning her new role, what would you recommend to her as the top 2 qualities to address? So I'm going to stop sharing my screen and invite our team here from Genesis, Pennsylvania to share your thoughts in leadership in long-term care. Top 2 qualities.
Good morning. Lead by example. I think that, and I'm a fairly new, center nurse executive or DON myself, and just trying to lead by example, being available, being present, being on the floor, participating in just overall daily activities with care, knowing your staff, just being present for them, and, just for everyone in general, not just nursing, but housekeeping, dietary, just making myself available to everyone as best I can.
Thank you, Kelly. So not do as I say, not as I do, but leading by example. Great way to start our discussion. And for those on the call who are not in leadership roles, it's very important to hear what you value in the leaders that are working with you.
Hi, this is Tina Pilkis. So for me, I think it's very important just to be available to my staff, just for any number of things, whether they just want to vent or just want an ear that's gonna just acknowledge, some things I can't change, but I can listen and I can be empathetic and I can, try to find some answers. I can't always have I won't always have all of the answers, and I can't always change things that are out of my control. But I think sometimes just that I'm there to listen and be heard is huge.
Mhm. And you use the word empathy, I think very important quality in leaders. So thank you. Oh, come on, team. It's our last time together. This is not the time to be quiet.
Hi, this is Alma from Laurel Ridge Center. I'm a CNE here.
Thank you.
Hi. I would say my staff really looks at me for clinical expertise. Anytime we get that complicated resident that comes in, they always look at me, like, what do we do? And if I don't know what to do, I know where to turn to, to pull up the policies and procedures, or what person ahead of me that I can call my consultant and ask, her what to do. So they want to see that confidence in me as far as clinical expertise goes.
Excellent. So clinical knowledge, expertise, and I would add to that being able to share that knowledge and expertise and bring everybody to that level of knowledge. So very important. Let's see how we did compared to what our national colleagues who prepared our program today thought. So let me go to the next slide. And here's what our experts said, and I believe we ticked off quite a few of these. So we talked about compassion, we talked about setting that example, and clinical skills and knowledge we just heard about. Openness and transparency. I think in some ways we didn't use those words, but I heard some of that in the ability to connect with everyone with whom we work, and humility. I think we heard that, where I may not know all the answers, and that's okay, and I'm comfortable telling you what I don't know. And then I would add to that, leaders then begin to develop plans for, well, let's get the knowledge. What are our next steps? And often using our quality improvement processes where we plan, and then we do, and we collect data, and then we adjust what we do based on the data we've collected, always looking to improve. I added this last one as well, ability to set clear expectations and then hold people accountable. So a well-functioning team has all hands on deck. Everyone knows their roles, comfortable speaking up if in fact they need more education or are not clear on what their role is. And then the ability to hold accountable so that everybody is doing their role and succeeding together. So I think this group, though quieter today than most days, really has that understanding of quality leadership and particularly the qualities during this pandemic that have served our leaders. So if you were to give Patty one piece of advice about leadership, what would it be? So let me stop there, and I want leaders to speak up, and I want individuals who are looking to their leaders for guidance. One quality, one piece of advice, I should say, one piece of advice moving forward in the pandemic. So we heard from Mr. Farrell what's happened, and although this video was done a few months ago, and he kept talking about where we'll be in December, where will we be in April? So what piece of advice as we move into the next phase of our response to the pandemic? If you can't unmute, feel free to place some comments in the chat box, and we'll share the chat box as well.
Hi, it's Tina again.
Yeah, sure.
So one important thing that I've learned is to make sure that you have a very good support system. I know for me, just reaching out to other DONs that are going through the same thing, and, you know, whether we're just venting to each other or just, you know, we have a question about a policy or something that we're looking for. I've been very lucky that over the last couple years, I've been able to, you know, keep those lines of communication open, and we can just text each other, call each other. And I think that's really been important, especially over this last year.
Great, thank you. And we heard Patty had some good mentors at other facilities, and you're emphasizing that that need to have your team supporting you. Thanks. Another piece of advice for Patty, or some advice that you received in your role going forward?
Hi, it's Melanie at Crestview Center over here in Langhorne, Bucks County.
Yes.
I would just say one piece of advice that I have certainly taken away from this past year and previous years is to be flexible. You know, you're always going to be asked to do new roles, new responsibilities. I think it's important that you are flexible and learn to be adaptable to those things. Because, you know, things are ever changing, and if your staff see you being adaptable, they'll do the same.
Yeah. Setting that example of flexibility. So the what will change, but always having that understanding of the why helps with that flexibility. Very good. Mm-hmm. And thank you, Jessica Copa, for putting in the chat. You shared compassion and teamwork, and that all hands on deck, all working together, all collecting data, reviewing data, and changing our approach with that flexibility that Melanie just shared with us. Great suggestions for leadership. Another piece of advice for Patty.
Dr. Bellantoni, I like to listen most of the time on these calls, but I think it was Tina, it might have been Tina a couple of weeks ago, who mentioned, you know, what she felt like after, you know, some of the staff that had been with her for a while just kind of left. Mm-hmm. And I think it shouldn't go unnoticed. Was that you, Tina?
Yep, that was me.
I thought I get on like,
Yeah,
I get on like 20 of these calls, so I can't remember who. I thought it was you. Yeah, it's like, that shouldn't go unnoticed, I think, is having a team and being a, you know, if Patty's a brand new leader, you know, does she know how to, you know, bring all the tools to the table to create a team around her? Because I remember when I was first a CNE, I thought I had to do everything myself. Like I thought I was, you know, I just had to go do it. If it needed to be done, I needed to do it. I didn't need to ask somebody. I didn't want to burden them or whatever. But, you know, now I think it's more evident than ever is that you have to have a strong team. I think Melanie is like, I think are you in admissions? I think you are. Is that what you said before? It's like,
yes, I'm in admission.
Yeah. So to her point, she's flexible. If I'm a CNE, I need to know how to use Melanie in my center. Mm-hmm. And so building a team that's strong around you is one of the only ways to survive anymore. It was hard before to the administrator's point on this presentation, it was very hard to survive in this world before. We have a very hard job, and now it was even harder. So having that team around you and being a good team builder and knowing how to utilize the strengths and weaknesses of your team. And to Tina's point, you know, those folks sticking with you and around you and being able to keep them on board with you is very hard during this time. And we have more challenges than ever. So I think that's some good advice for Patty as a new CNE.
Yeah. There was a time that leaders were thought to be the best at what they do, but now leaders are the best at bringing their team to the best they can be. And most leaders now are judged by their team's performance, not their individual performance. And so Jessica Copa put in our chat box, learn to delegate. And indeed, leaders, effective, appropriate delegation, acknowledgement of the roles and then the responsibilities of the entire team. So terrific.
Also, following up, I think that, when I had to learn early on in my career, starting out as an LPN, working my way through as an RN, that you can delegate, but it's only as good if you follow up, and just making sure that, again, holding people accountable, but that part builds a team, because if they know you follow up with them, they'll do the best that they can do, because they know that, you're going to come back to them and, to check and see their status, to see their progress. And then being available also, if they do need help, that you'll be there to say and coach them and kind of help mold them along the way also. So the follow-up, you get to learn what other people need help in, what they're strong at and what they're weak at the same time. And you can kind of build that team, that part of the team together.
Mm-hmm. And that's where using our quality improvement tools, so that with that follow-up, you have data to react to rather than anecdote, and using that data to inform our team and make our team better. Brian Gula said in our chat box, leadership is not about being the best. Leadership is about making everyone else better and that team together better. So I couldn't find a better way to close out our 16 sessions than with that quote, Brian. So thank you very much. Lindsay Burbano put in the chat box, do not be too hard on yourself. Very true. Finding that time for, or giving permission to fail. And I think I have some slides coming up from Paige Hector with that advice, that if one doesn't take some risk and isn't afraid to fail, one will not advance, and learning from our failures and taking those opportunities to do better. Let me go back to sharing my screen, and we'll go to the next slide. What are at least 2 ways to communicate with residents, families, and our care partners, municipal leaders, the public, anyone in communication, because this session is about leadership and effective communication. So let's talk about strategies to communicate and promote awareness and knowledge, any particular aspect of COVID care. And I won't say, let's not go backwards, let's go forward. What do we feel are going to be our challenges as we finish up our Project ECHO sessions together? What are you anticipating are the COVID-19 challenges? And what strategies might you consider for effective communications of these challenges? So let me stop sharing my screen and ask the group to talk about leadership and communication, and particularly related to our next challenges in COVID-19. So let's start with what are those upcoming challenges we anticipate, or what are we dealing with right now, March 18th? No challenges. Tina?
So I think one of the biggest challenges we're going to run into is that we're opening back up to visitation, and with the the restrictions still in place with the hugging and kissing, and just trying to be sympathetic but still limit the contact that they have with each other. is really going to be a huge challenge, especially since the new guidance talks about letting them come into the facility and letting them come into the resident's room and not being able to monitor things that are happening behind the curtain and behind closed doors. And, is it fair to the roommate that's not getting the visitor? I mean, there's just so many things that come into play with this next step.
Very, very relevant, very timely. And now that the CDC is saying touch is permitted, but there's a difference between touch and keeping that mask in
Correct.
place for respiratory. So what strategies would you say about effective communication with this incredible challenge that you've identified?
Well, we've been very consistent with having our family calls from the very beginning. When the whole outbreak started, we were on daily calls, then we were twice a week, and then we were eventually able to go to once a week, which is still something that we continue to do even now, is we have a call, even with the patients that come in on the observation unit. We're very transparent about any new things that come into play, whether we have somebody who tested positive or staff that test positive, and what we're doing about it. So the lines of communication have always been very free and very open. And these are some of the things that we're discussing when we're on our calls with the families. The expectation right now, we, before we had it closed for a little bit, we were still doing visitations in the lobby with the screen in between the patient and their family member, limiting it to 20 minutes, cleaning everything in between, then having the next family do their visit. But I'm speaking personally, I don't think that mentally and physically we're ready to open up to the hugging and the kissing and all that stuff right now.
Mm-hmm.
So we're just taking baby steps. We're just, we're seeing where it goes. We're allowing, hopefully starting next week, the visitations back in the lobby being monitored. And as the rates go down in our community, I think we can start moving in, more of an open direction. But I think right now we're stepping cautiously. Families are, as understanding as they can be. But we've always been very open and very forthcoming with all of them.
Mm-hmm. So using your town hall sessions or call
Yes.
families as a very effective form of communication as visitations open up. Very good strategy. Joanna Applegate said in the chat box, the different standards coming out for vaccinated and unvaccinated residents and how to manage these policies in real-time practice. How would you know at a glance if a resident's vaccinated? So very, very timely challenge moving forward with COVID-19. And strategies for communicating that standards are different. Vaccinated new admissions who are vaccinated do not have to be quarantined in the state of Maryland right now. I don't know what Pennsylvania's current policy is or what your Genesis Corporation has said, but these types of practices are evolving now. And how do we communicate these different standards? I will say we started vaccinating our hospital patients planning for post-acute care. And we are using the Johnson vaccine so that it's a single dose and so that within 2 weeks they will be fully vaccinated. So we're recognizing the role the hospitals play in assisting our skilled nursing facilities with this issue, but communicating that very challenging. And Stephanie Cole put in the chat box, we open up on Monday and it scares me that families aren't going to be tested before coming in and they are allowed to hug at the end of the visit. And Stephanie, I share your concerns there. Perhaps here's an area where our scientific knowledge might help us more. knowing that this is a respiratory virus and that if individuals continue to wear their masks while they are hugging and that they've performed hand hygiene before the visit and at the end of the visit, that hug is really thought to be, from a scientific point of view, a very low risk transmission. Residents are screened for symptoms, although we know about asymptomatic spread. But I share your concern, but in some ways reminding staff of what we know today about virus transmission might help us with some of that fear. But we also recognize that community prevalence of the virus will play a role in visitations. And should there be new surges in areas, visitations will be closed. And certainly if there are staff or resident cases, visitations will be closed. And those guidelines are coming up, or they are out, I would say, and our leadership understanding them. But certainly, Stephanie, I understand you've identified a very important March 18th concern, and I hope I've given some strategies. Jessica Copa put in the chat box, keeping our census up and our staffing adequate. We've certainly seen in our space early in the pandemic that financial challenge with lower census, and then that additional burden of staff turnover. At our American Medical Directors Association meeting last week, we heard from a national leader in this area that we're greater than almost 130% turnover per year currently in our staffing, which means everybody turns over more than once. And real challenge, and 1 in 3 are turning over twice. So that's a huge challenge in our team building and our maintenance of our team and our knowledge of our team. New team members are very challenging to bring in and to make that team cohesive again. And let's see, I want to make sure I got everybody in the chat box. Brian Baslick said to us the fear of nursing homes. And certainly we saw that our community fear with the spread and the mortality in nursing homes last spring. Some of that still remains, and certainly needing to address that as well. Any other comments from the group?
Yeah, I just want to kind of go on what Brian said about the fear of nursing homes. I'm the admissions director here, and I'm not so much seeing like fear of the virus anymore. It's just fear. People, I'm just going to speak candidly, people don't want to voluntarily bring themselves into a prison. And things are easing up. And I think, you know, with the vaccines, we're seeing a light at the end of the tunnel, but that is the fear that I'm seeing. Is we've been at this long enough, people in the community understand the restrictions that the nursing homes are under by now. And they, you know, they're going home maybe inappropriately when they really do need skilled services to try with home health because they do not want to, they do not want to go to a prison.
And so the population we're serving now are much higher medical acuity, and they may have in fact suffered complications because of what you've just said. So our population that we serve is somewhat changing. Yeah, very good point in our what are our leadership challenges today, March 18th, and then strategies for addressing that. Let me share my screen again and continue on. And Paige Hector shared with us what matters to staff, and I won't show her video today, but I'm going to take some of her major slides, and she shared with us what matters to our staff, and I think we heard some of this in our discussion. Being supported and valued are two of the most important qualities leaders can convey to staff and supporting staff. At last week's national meeting for medical directors in skilled nursing facilities, I did a symposium with Dr. Nazir. He's our immediate past president of our organization, and he is a medical director of a large corporation of skilled nursing facilities, not Genesis, but another. And he goes around to facilities and does focus groups with staff, and all types of staff, the environmental services, dietary, recreational therapy, nursing assistants, as well as leaders of the facilities. And he really does explore what motivates his staff, what challenges them, just the things we've just talked about, their perceptions of the teamwork, their understanding of the regulatory issues. And he gets from them that last bullet, innovative ideas. And he actually started in our organization a Shark Tank, where when our annual meeting, we actually start our annual meeting now with any members can present to the group innovative ideas, and winners receive funding to move their ideas forward. So it isn't like a research grant or a scientific grant. It really is great ideas, just like the Shark Tank show on television. And it's the most well attended of our annual meeting because people bring their ideas. And it's an exciting time for exchange. And that's a strategy he uses within his own organization as a physician leader to work with all groups and get these innovative ideas from what challenges his staff most. And Paige Hector has worked with Dr. Nazir and put this into the video. He did a wonderful review article for our medical journal, and we've had other articles we've reviewed. No one cares when your plane doesn't crash, meaning that good, strong teams just get the work done, but we learn from what goes wrong. So is there anything you're doing right now that you would want to keep? And that's a comment Paige had in her video. So we've done a lot of things differently because of the pandemic, because of regulation. Is there anything you're saying, well, here's a silver lining of COVID-19 in our nursing home, and we don't want to lose this as we go forward and COVID becomes like influenza, a yearly vaccine, we test for it, we do certain procedures, but and soon we hope this time next year we'll even have more effective treatments like we do with Tamiflu for influenza. We think we'll be there at this time next year. So tell us, what do you think about the next wave?
Hi, this is Christina from Norton Square.
Yes, Christina.
One thing that I really have enjoyed is actually my family Zoom calls. I have been doing them weekly, for a long period of time at this point. But I have mentioned to them going forward, even when all of this is truly over, even just doing like a monthly, family Zoom where we can talk about what's going on in the center, if there's been any changes with policies or anything like that. I just feel like communicating with them directly and me speaking to them directly and them posing questions to me directly at their convenience of being at home as well has been so vital to our success. And I really enjoy it. And I definitely would like to keep doing that moving forward.
Great. That is a great silver lining of the pandemic. We're all getting better at this. Mm-hmm. Any other? I'm going to keep this no matter what happens with COVID-19. All right, let me move on in our presentation. Paige highlighted trustworthiness and transparency, and we've talked about this during the session and prior sessions. And one of the ways we do that are the regular updates, just like you've just mentioned, not just for staff, but for families and residents. And even if there is nothing new to report, sometimes just saying we're holding tight, this is working, and just making that check-in. And we've done that ourselves in our own group of physicians here in our division of geriatric medicine. We do a check-in for physicians only first for about 20 minutes. And then we invite the entire group of our division, all of our staff, our administrative assistants, our nurses, everybody who's part of our research assistants, and we all check in together. And we're continuing that. Our frequency has been reduced. We were doing this once a week because so much was happening. But as things begin to quiet down, we've moved it now. We're currently twice a week for these check-ins. So that is something we continue as well. And indeed, we are doing it through these virtual conferences so that everybody doesn't have to stop what they're doing. They're at their own workspaces, and some are working from home, and some are in their research labs, and some are in the clinics. But you can stop for 15 minutes and just on board and say hi to everyone, catch up socially and catch up professionally. Here's a concept that Paige brought into her video, which is radical acceptance. And we may see some blips in the road for COVID-19. Europe right now is in a major surge. The United States tends to be about 3 weeks behind with European prior surges. So if we learn from our prior experiences and with what's happening with some spring break social changes and public health issues, this radical acceptance concept comes to mind, which is accepting reality without resistance. And basically, we had to accept the reality that we had a new virus, it was deadly, it was in our space and long-term care. And rather than waste too much time over that, we have to say, we know, now what are we going to do about it? And I think that is something that I want to make sure we all leave our Project ECHO recognizing that the pandemic is not over. We will have new challenges and we have to identify them, accept them, and then move on and not waste a lot of undue energy. This is from the summary of today's session from the IHI. And I want to be sure that we did actually talk about this and use the reference of John Cotter's book, What Leaders Really Do. And his examples of how leadership is demonstrated, leading with your heart and soul, using tough empathy. And again, I think our group has said that. Setting that positive example and being visible. Let's check that box. We've talked about that. Leading with values and inspiring a culture of excellence. So setting those expectations, but those expectations for all, not just the leader. And then I believe I've highlighted that having that courage to take risk and permitting failure, provided we learn from our failure. And that's the importance of the quality improvement strategies. We've got to know when we fail and why we failed. So collecting data, not just using anecdote or single experience as we change what we do. Making sure we have that quality of life, that humanism, and humor when appropriate is a very good tool for de-escalating very challenging events. However, humor done inappropriately, in fact, can add fuel to fires. And then leaders need to show their weaknesses, their differences, and be human, which we've talked about. And I love this sentence: leaders need vision, energy, authority, and creativity, and supporting that team and having that team lead or that team be successful. And Paige reminded us that we often have to hold two conflicting thoughts or emotions. So getting back to that radical acceptance, okay, we've got a deadly virus, it's in our space, and moving on. And what are we going to do about it? Well, we know it's a respiratory virus, so we know that if we mask and we wash our hands and we keep social distancing and we test, and when we know that the virus is not in our staff and in our residents, we can begin to relax some of these social isolation practices. So basically, sometimes we've got the and we've got to manage both sides of that conflicting emotion. I'm going to move now to the last video for this session, also from Mr. Farrell, a nursing home administrator, because he shows us a good bit of using our quality improvement tools in leadership in this particular slide. So let me end the slideshow and bring up this video for us to view.
Hello, this is David Farrell, and thanks so much for joining this ECHO session. So appreciative to take some time with you to talk about the QAPI aspects of leadership during COVID-19. Let's get started. So as you all know, the QAPI requirement of nursing home encompasses these 5 specific domains: design and scope, government and leadership, feedback, data and monitoring, performance improvement projects, and systematic analysis and action. For the 20 minutes that I have with you, I want to encourage you, number one, to keep your QAPI steering committee alive and active during this pandemic. After all, there are plenty of performance improvement projects to engage in as it relates to COVID prevention and mitigation. But primarily today, I want to focus on number 3 and number 4 on this visual, and talk specifically about data measurement and acting on it. So here are 3 specific buckets, if you will, related to COVID data. And I want to speak a little bit about each one of them. The first bucket is your structural measures of quality. And the structural measures of quality that your QAPI steering committee should be tuning into are the structural measures that measure the nursing home's organizational capacity to prevent and handle an outbreak. Next are your process measures, or your COVID process measures. Process measures measure the performance necessary to prevent the virus from getting in, containing it if it does, and to care for those who test positive and negative. And then finally, the COVID outcome measures are the ones that we read about in the news and the ones that tend to get the most attention. And of course, those COVID outcome measures include the number of positive cases, the number of deaths, and the number of people who have recovered. So let's dive into each one, starting with structural measures of quality under COVID-19. So here's some examples of some structural measures which really predict the nursing home's organizational capacity to keep COVID out or mitigate the spread if it gets in. And of course, some of those structural measures include staffing, your total number of hours per day, the total number of nursing hours per day, your total number of RN hours per day. Another structural measure would be, do you have a full-time RN who's in the role of infection preventionist? And other structural measures would include the number of vacant positions you have in your nursing department, the number of shifts worked by agency staff to fill those shifts, and the number of shifts that are understaffed. Additional structural measures which measure your organizational capacity would include your days of PPE on hand, your environmental capacity to cohort. In other words, do you have empty private rooms with private bathrooms? And also, do you have a contract in place with a reliable lab that will deliver timely results? Critically important as a structural measure of quality during COVID-19. Some of the process measures to consider, and remember, process measures are the measures of things that your organization needs to be doing to keep COVID out or prevent the spread if it gets in. And some examples of those include the percentage of people entering the skilled nursing facility that are properly screened or not, the percentage of staff who completed competency testing, hand washing, donning and doffing PPE, all the competence tests associated with COVID. What's the percentage of staff who completed those competency tests? What's the percentage of consistently assigned staff that are consistently assigned to certain designated zones or wings? What's the percentage of staff still working 2 jobs and potentially bringing the virus in from another nursing home? Have we completed our weekly assessment of preparedness? Do we have a score that we're monitoring every single week? What's the percentage of advanced system surveillance checks that we've completed? In other words, if we're checking for symptoms in our residents every 4 hours, let's audit to see if that process is actually in place. And of course, what's the percentage of staff and residents tested this week? If we know that screening testing is our best defense, how many folks were actually screened this week? So here's some examples of the things that, measures of the things we have to do consistently to keep COVID out or from preventing its spread. And then some examples of outcome measures under COVID include these: your coronavirus test positivity rate, both for residents and staff, the percentage of positive residents and staff who've recovered, your census in the red zone, is it increasing, is it decreasing, the number of hospitalizations, the number of deaths, the Department of Health focused infection control inspection results, how many deficiencies did we get? Were we deficiency free or not? Other clinical outcomes, we know that we need these balancing measures, if you will, to determine if pressure sores are going up or falls are going up as a result of our keen focus only on COVID. So we want to look at other clinical outcomes. And then, of course, grievances from residents or families or that have been sent to the ombudsman. These are good measures of outcome measures related to COVID. So then, of course, we can show staff some visuals of some of our outcome measures to get them excited about trends that might be going down related to new hospitalizations or the positivity rate. So we're measuring or testing our residents and staff aggressively, but lo and behold, our positivity rate is going down. There's a good trend. And here's an example of a process measure, the percentage of staff properly screened before clocking in. As you can see, back in March, we weren't doing so well, but as we've implemented a performance improvement project, as you can see, we're getting much better compliance in July than we did in March. So there's other key variables related to the size of outbreaks in nursing homes that we want to be mindful of. And this, of course, this is all based on the literature. If you're a larger facility, then you certainly that would be a variable.
I'm going to stop there and stop sharing my screen and ask Dr. Victor Bogoslavsky to kind of summarize the quality improvement aspects of our leadership and communication session today.
Well, thank you so much. Thank you, Michelle. And thanks to everybody. This is just a great conversation and the discussion. I feel humbled, to add to the leadership qualities, as we were just talking about, that would be, in front of the leaders who have been going through this crisis for a year or more. And I think those qualities are very, very relevant to the quality improvement as well. I was just thinking about, we're talking about COVID reality or new reality, but this is also an opportunity. What I'm thinking is for applying quality improvement set of principles and tools, and to be able to enhance the capacity of the staff to solve problems using those tools, be flexible, learn from the experiences, adapt to the changing environments. And those are the skills that leaders would need to support. They would support teams building capacity for quality improvement, work with them, allocate time for them to support the teamwork, provide with resources, simple resources to be able to give them flip charts, computers, to be able to look at the data, and be available to meet with them for the data. But also the point is really to build a culture of quality improvement where leadership is not only essential, but I think critical to build this ongoing sort of journey of quality improvement. It's not one-time undertaking. It's a journey that starts and never ends. And I feel that this is really an opportunity for us to think creatively and apply those kinds of principles. But this is our last week, and I just wanted to say that how grateful I am for the opportunity to be with you for this 16 weeks. learn from you, to capture your ideas, to communicate those ideas with our larger community. We all need to learn from you and to think about how can we put this into the longer term and sustainable perspective. So I'm really grateful for that, and I'm obviously thankful for the opportunity to be able to contribute to your hard and incredibly important work. Thank you so much.
Thank you, Victor, for your contributions these 16 weeks. I'm going to close by saying where I started 16 weeks ago. I want to thank all of our healthcare providers in Pennsylvania and our post-acute long-term care session. Thank you for the care you've given to my family members. I will be giving medicine grand rounds at Tower Health Reading Hospital on the morning of Wednesday, April 7th. And the topic is transitions in care, partnerships of hospitals and skilled nursing facilities. I will certainly be talking about these sessions and the incredible work that you are all doing to support the care that's happening at Reading Hospital and the healthcare system there and across the state of Pennsylvania. So with that, I'm going to say to everyone, you'll be hearing from Karen Bleck and myself with your attendance and with instructions on how to meet the requirements from Project ECHO of 2 staff members completing 13 of the total of 16 sessions. So give us a day or 2 to get this together because Karen does have to enter today's registration first before we complete this process. But we will be in touch. And with that, I wish you all continued success, both personally and professionally in the work you do. And thank you for the work you do. And with that, I'll say bye. Take care.
Thank you. Bye.